Hello, I'm Kay Taylor, Union University student, and today I would like to talk to you about a very important subject, advance directives. If you were unable to verbalize your desire regarding medical treatment, whether to give or withhold it to prolong your life, would your family know what your wishes are? If you answered no to that, and even if you answered yes, it's very important that you have an advance directive. Today we're going to talk about what is an advance directive, how is it important for you as an individual to have an advance directive, why it's important for your family that you have an advance directive, and finally, where can you get an advance directive and what do you need to do with it. So to begin with, let's talk about what is an advance directive. The clinical ethics textbook says that the advance directive is an instruction given by individuals specifying what action should be taken for their health in the event that they are unable to verbalize their desires due to any kind of incapacity. There are several types of advance directives. We're going to talk about the two most common types today, and those are living will and a healthcare proxy. So first of all, the living will states in writing what your desires are, step by step, what you wish to have, what you don't want to have. You can add things, you can mark through things. The form is very straightforward, and it's your desires. It's in writing, it's a legal document, and it has to be followed to the T by medical professionals. Nobody can change that. Your family can't step in and take away anything that you put on that document. So it is your decision what is on that document, and you have the right to choose whatever you wish and to deny whatever you wish. The healthcare proxy is a little bit different. In the case of the healthcare proxy, you don't have any written instructions. There is still a legal document that says that you have chosen someone that you trust to make the right decisions and that they would act in your best behalf in the way that you would want them to act. Now that's kind of a tough one because you have to be sure that that person is going to make the decision that you've asked them to make. Make sure that they're not going to, in an emotional time, do what's best for them and take their feelings and the thought that they don't want to lose you into consideration when making their decision. It has to be based on what you have directed that person. So it's very important that you choose whoever is going to be your healthcare proxy very carefully so that you know that your wishes are carried out. So how does it benefit you to have an advance directive? There are a few reasons that it benefits you. First of all, as I said, you know that your wishes are being carried out. You know that everybody's going to follow your instructions. It's the law, they have to, and you can rest easy knowing that if something happens, you're not going to have anything that you don't want to happen. It also it's better because you get to make the decision while you're clear-headed. You're not in a situation where you're already sick and you're having to make these decisions and you're really not sure what to do. And once you are in that situation, if your judgment is clouded by medications, it's not legal for you to make that decision anymore. It's not a legal document if you're under the influence of anything when you make this document. So it's important to plan ahead and do this now so that you are assured and rest that knowing what you want is what's going to happen. How does it affect your family for you to have this advance directive already in place? Well, pretty much it just puts them at ease knowing that they made the right decision because they made the choices that you wanted. They didn't really have a choice. You left it outlined. It wasn't something that they could decide upon and wonder the rest of their lives that they make the right decision and go through that agony and thinking, what if they had gone the other way? Would things be better? It also puts them, they're going to be in an emotional state anyway at the thought of losing a loved one, and it's just one less burden that they have during that time. So let's talk about now, where can you get an advance directive? They are really easy to get. You can go online, you can just Google advance directive and it will pull up all sorts of different forms that you can fill out. There are living wills that you can fill out, print, fill out, sign, have witness. There's not anything difficult about this. All you do is fill it out, have it witnessed, and take it with you when you get health care. so you can get them online. Your primary care doctor will probably have one in their office that they would be willing to give you and assist you in understanding the medical jargon that's in it so that you know exactly what you're agreeing to or disagreeing to. And you can also, if you go for any kind of healthcare treatment at a medical facility, a hospital, freestanding surgery clinic, whatever, they usually ask you when you check in if you have an advance directive or living will. And if you don't, simply tell them no, but you would like to have one, and they will also be happy in assisting you in filling that out and having it signed and witnessed. Be sure to take this with you every time that you seek medical care so that everybody involved knows your desires and you don't have to worry about somebody making a decision that's not the decision that you would make. So having said all that, I hope you understand what an advance directive is, how it affects your family, how it affects you, and where you can get one. And I would like to leave you with this one thought. Please don't put off getting an advance directive until you need one, because then it's going to be too late. Thank you.